Hi, Dr. Ratnakar. I have a few questions for you. Uh, uh, can you brief us about the need of for digital diagnostic in resource-limited settings?
Sure. Today, when you look at diseases or areas like antimicrobial resistance, digital diagnostics is an important initiative which the government and the private sector should look at it. More importantly, in resource limited settings where the diagnostics are a real big challenge, some of the interventions like bringing in AI and ML in terms of detecting certain bacterial infections today becomes the need of the hour, and we should look at some of those interventions coming up from large tech companies, also from the startups who can actually bring in the required interventions. Reason why it is required in today's context is when you look at typically a person is coming out with any kind of bacterial infections, the amount of time taken for a physician for a culture test to be prescribed and the results of the culture test takes anywhere between 24 to 36 hours. Digital diagnostics, how it helps is some of that's what you can actually see today. The innovations coming up with a number of startups where whether it is urinary tract infections or respiratory tract infections or sepsis can actually come in within minutes, which means that a doctor, instead of actually giving a prescription empirically, today with the help of digital diagnostics, they can actually give prescriptions in a much more strategic way, much more important way, and more importantly, this becomes a clinical decision support tool for the physicians while prescribing any antibiotics.
All right. And sir, very good response, sir. And thank you for a elaborative view on that. Sir, what are the current challenges with the antimicrobial resistance (AMR)?
Thank you. WHO actually is, upfront in stating that antimicrobial resistance is the next pandemic, which means that there is an intervention and there is an urgent need across the sectors to curtail and contain antimicrobial resistance. Towards that, the challenges are multifold because antimicrobial resistance is not just limited to humans. It has to be addressed holistically from an One Health approach, which means animals, livestock, your aqua, and humans and agri should all be addressed as a entity in which antimicrobial resistance can be addressed holistically. Today, there is a larger need to bring in newer and novel antimicrobials which are not there, which is not available. So, a lot of interventions are coming in over there. Second is, lot of diagnostics are actually required, and that's also an important intervention which need to be looked at. And there is also a lot of need for antimicrobial stewardship, which is also required. Last but not the least, awareness has to be multifold. Towards that, there are multiple initiatives right from the global to the regional. So it is called as global action plans, national action plans, regional action plans, and state action plans, which are actually been announced by various governments and also states. In India, there are already 4 states which have implemented their action plans for antimicrobial resistance.